In America, even science is now a battleground. The debate over vaccines has become a symbol of our deepening divisions, with trust in institutions at an all-time low. The once unified consensus on vaccines is fracturing, with states taking wildly different approaches and citizens caught in the crossfire. Families are left to navigate a maze of conflicting rules and recommendations, unsure who to trust. Years of growing distrust, supercharged by the COVID-19 pandemic, have turned immunization into a partisan issue. Social media amplifies every rumor, making it harder than ever to separate fact from fiction. Republican-led states are rolling back vaccine mandates, citing personal freedom and skepticism of federal authority. Meanwhile, Democratic states double down, forming alliances to counteract federal skepticism and pledging to protect public health through stricter policies. Misinformation that was once fringe is now mainstream, making public health officials' jobs nearly impossible. They face mounting pressure and even threats as they try to keep communities safe. This isn't just about COVID-19. Skepticism is spreading to routine childhood vaccines. Diseases once thought conquered are now making a comeback. The result? A patchwork system where your health depends on your zip code, your state's politics, and sometimes even your local school board. America risks unraveling decades of progress against preventable diseases, all for political point scoring. The stakes are higher than ever before. The consequences could be catastrophic for public health, threatening not just individuals but entire communities across the nation. How did we get here? To understand the current crisis, we have to look to the very top of our nation's public health leadership. The decisions made in Washington have sent shockwaves through the entire system, affecting every level of public health in America. The Department of Health and Human Services, now under the leadership of Secretary Robert F. Kennedy Jr., has dramatically upended the CDC's traditional role. Kennedy's controversial approach has sparked debate and concern among experts and the public alike. Kennedy replaced the CDC's Independent Vaccine Advisory Committee with individuals known for their vaccine skepticism, raising questions about the future of immunization policy and scientific integrity. He also slashed funding for mRNA vaccines, a move that has left many scientists alarmed about the nation's preparedness for future outbreaks and the ability to respond quickly to new threats. The abrupt firing of CDC Director Susan Monterez triggered a mass exodus of top experts, leaving the agency depleted of its most experienced minds and creating a leadership vacuum at a critical time. Kennedy's so-called refocus is seen by many as not just a shift in priorities, but as the dismantling of the nation's public health infrastructure, undermining decades of progress. As a result, conflicting federal guidance has left the public confused, anxious, and increasingly distrustful of official recommendations, unsure of whom to believe. After the FDA approved a new COVID-19 vaccine, the CDC issued guidance recommending it only for those over 65 or with pre-existing conditions, a far narrower recommendation than in previous years, leaving many Americans uncertain about their options. When top officials can't agree, public trust collapses, and the consequences ripple through every community, leaving the nation vulnerable and divided. With federal leadership in chaos, the responsibility of managing public health has increasingly fallen to individual states. States are forging their own paths, creating a mosaic of different approaches and policies. In Florida, vaccine mandates, including for schools, are being eliminated, a radical break from decades of public health practice. This has led to significant controversy and debate. Texas lawmakers are pushing bills to curb mandates, prioritizing personal liberty over community health. The state is becoming a battleground for public health policy. Meanwhile, California, Oregon, and Washington have formed the West Coast Health Alliance, pledging unified, science-based vaccine guidance. They aim to present a united front in the fight against the pandemic. States like New Mexico and Colorado are also ensuring vaccine access, directly countering federal rollbacks. They are working tirelessly to protect their populations. The result is a fractured landscape, states acting like independent nations, each with its own health policies. This patchwork approach creates confusion and inconsistency. This balkanization leaves Americans' health dependent on geography, not science. People are receiving different levels of care based on where they live. The nation's ability to fight disease is being dangerously undermined. The lack of a cohesive strategy is putting lives at risk and straining the healthcare system. As politicians clash, the medical community is rebelling. The American Academy of Pediatrics broke with the CDC, issuing broader vaccine guidelines for children, a first in decades. Doctors and experts are now forced to choose between conflicting recommendations, creating confusion for families. This split erodes the authority of public health and opens the door to misinformation. Experts warn that dismantling mandates will bring back diseases once thought conquered. The scientific community is sounding the alarm. We're gambling with children's health for political gain. The risk of outbreaks is rising as trust in science crumbles. The stakes have never been higher. The chaos has reached insurance, creating new barriers to vaccines. With CDC guidance politicized, insurers are no longer required to cover all recommended vaccines. Now coverage decisions vary, and families may face unexpected bills for immunizations. This financial uncertainty fuels vaccine hesitancy and gives new ammunition to anti-vaccine activists. Economic anxiety joins fear and misinformation, further depressing vaccination rates. Public health depends on trust and cooperation. Both are eroding fast. The vaccine schism is now a full-blown public health crisis. Decades of progress are at risk, and preventable diseases threaten a comeback. America's shield against outbreaks is fracturing, one political fight at a time.